respiratory. Hi, Mr. Williams. My name is Amy, and I'm a respiratory care student with the respiratory care department. And today you have been tried to have an oxygen tank today. So first off, before I begin anything, I need to verify your name and date of birth, okay? Alright, so I can verify that by the tag on his wrist, or I can have him speak the name. So then, before I ever give any oxygen, I'm going to check the vital signs and make sure everything is okay, and then I will proceed. So with this oxygen tank, okay, the way you can tell this is oxygen is the green tank, okay? Then on here, it also has a label on it that says oxygen, and that can verify for you what it is. Alright, with this you don't want anything covering the top of it because it's a combustion, and so it can go off if you have anything covering it. No smoking around it, so please be careful of that. So when setting this up, you always want to crack the cylinder, so I crack the cylinder to make sure there's no debris or anything in it. And for any tanks they have, so like oxygen has a pin index safety system, so this one only goes to the oxygen because of the 2 pins. And then the washer here, it doesn't look cracked, so it should be good and it won't have any leaks. So when you want to put it on, you have it super tight into the thing. You don't want any leaks or anything coming out. Alright, and then today your doctor had a nasal cannula, so we are going to attach it down here for you. And then I will slowly open this up. No sign of leaks or anything. Alright, so then I'm going to check your tank to make sure the PSI. So it's at 1,000, so I times that by 0.28 and divide it by the liter flow. And today he said to have it at 2 liters per minute. So then I can always check to make sure it is coming out of your nasal cannula. To turn it off, you turn it the opposite direction, make sure you have it at 0. And before you take off a regulator, make sure all the pressure is out of your regulator. And then you would always turn it back to 0. Then you would unscrew it. And remove it. Alright, now if they just want oxygen flow out of the wall outlet, this is a Thorpe tube. So this you connect it. It's a quick neck, and you can drop watch the little float there go up and down when you connect it. So you can turn this on to make sure you have a good flow, like that. And if you cover the hole, it drops the ball because there's an obstruction. And then just to release it, you turn this, and then that releases it. Alright, and so then before I leave with the patient on oxygen, I want to always check the vital signs and everything before I leave. And thank you, Mr. Williams. Do you have any questions for me? Alright, perfect. Alright.